This paper looks at the prevalence of long COVID in our society by doing a systematic review and a meta-analysis. First, it's important to note that sometimes long COVID is referred to as post-COVID syndrome, which is using that 12 weeks or 3 months criterion of new or persistent symptoms that can't be explained by an alternative diagnosis. They reviewed papers from January 2020 to April of 2024, where the paper had to have long COVID as a diagnostic criterion, in addition to a confirmed COVID diagnosis, and they also had to have undergone some sort of assessment at 12 weeks post-COVID infection or beyond, meaning that those long COVID outcomes were then verified by this method. For all the studies they reviewed, 48 studies met these eligibility criteria, and 16 of those 48 studies were accepted for meta-analysis, where the shocking finding is that the pooled worldwide prevalence for long COVID was about 42%. And after initial diagnosis, the prevalence did not seem to change after the first year, where they looked at 3 months, 6 months, and 12 months after long COVID diagnosis, and the prevalence was 45%, about 41%, and about 41%. Additionally, the prevalence between sexes was approximately equal, with women on average being slightly more frequently diagnosed with long COVID, a 47 to 53 split, but when we look at those confidence intervals, they do overlap, so the prevalence should still be approximately equal between the two groups. And relevantly to the US, the prevalence of long COVID is sitting at about 46.3% right now. Diving into the paper a little more, inclusion criteria for a study was 1, availability of the full text, 2, it had to be written in English, 3, it had to be published between January 1st, 2020 and April 27th of 2024, 4, the study had to be related to long COVID, with initial COVID diagnosis confirmed using PCR antibody testing or a clinical diagnosis. 5, the study had to have an index date, meaning they had to have the onset of COVID date, the first test or diagnosis, the hospitalization date if relevant, or the discharge date if relevant. And 6, the study had to have adequate data on estimates of overall long COVID prevalence in a community. And as mentioned earlier, 7, they had to have some sort of assessment date or follow-up or clinical checkup date at least 12 weeks after the index date, since that's one of the criterion for meeting the long COVID diagnosis. Relevant articles were identified from 5 databases: the Web of Science, Scopus, PubMed, the Cochrane Library, and Ovid Medline, where they identified over 3,000 potential articles. They removed about 1,000 at initial screening. The screening process brought it down to 89, and then the final screening criteria brought it down to 48. Among the 48 studies, 21 were from European countries, 14 were from the American region, 10 were from Asia, and 2 were from Australia, and 1 was from Africa. These studies involved sample sizes from 106 up to about 124,000. Additionally, most of the examined populations were adult-aged, and the percentage of female participants varied wildly from about 26% to about 78%. The 48 then got whittled down to 16 for the meta-analysis. This was due to some asymmetry in the data, and that's how they arrived at that approximate 42% prevalence number for long COVID worldwide. And this is what that spread looked like for those 16 selected publications, where if we try to pull out the most extreme cases, our most conservative estimate for long COVID based on this data is somewhere between 26% to 58%. Additionally, if we look at all of the data and do the same type of quick poll for America, our most conservative range is a long COVID prevalence between 19 and 84%, where again the average long COVID prevalence in America is sitting somewhere around 46%. In terms of the sociodemographic long COVID prevalence, female patients were less likely to have recovered from long COVID than male patients. However, some research suggests that there might be a referral bias due to a higher participation in follow-up care by female patients compared to male patients, meaning that women are more likely to seek care than men, and that might be skewing the data. Additionally, as we've previously noted, there seems to be an adequate vaccine responsiveness in the long term for individuals with higher BMI, which, as we've already shown, means that people with higher BMI should get more than one vaccine a year for COVID.